research is gathering as much data and information possible with a rational method in order to get knowledge to improve the subject of the research in healthcare and health and social care, improve practices and policies is the aim, the final aim. The outcome, as I was saying, is the booklet that was designed to ask the patients and families and carers to provide info about the patient. This is very important because when we're talking about evidence-based clinical decision, those matters are really important. I was talking about when my laptop failed, about all the work done by the universities that came at first in the article. All that research was very important when we try to make an evidence-based clinical decision. I mean, it's the first step, it's the first thing to do. Then evidence and assessment to the patients and the physicians and GPs and all that information is also a huge part. It's very important. Talk all the information about patient preferences and values. I mean, culture, food habits, religion, all those things are really important to assess and to make a well evidence-based clinical decision. Also talk with their families, clinical experts and opinion leaders. We are referring to those articles produced from the university that everybody that we saw in the article. When we need to have a topic when we start doing our research. The topic, it's a question that defines the aims, the objectives, and we need to put some hypotheses at start. The literature review, with the articles related with the subject that we are looking for. The methodology is always quantitative and qualitative. The qualitative is about words and texts and emotions. The quantitative is about numbers, data numbers, statistics. We need to have a sample in the article. The sample is within that auspice, the set of patients that they were focused with. Surveys, questionnaires, and the conclusions must be summarized, well summarized, to produce an effective tool, which they did with that booklet. And there must be a conclusion to be published to help other services within the area to improve and benefit from all that research work. The skills needed to conduct that literature review that they made. Well, we have the professional and personal skills. Within the professional ones, well, there are loads of them: project management, budgeting, staff allocation, all that. But the ethical issues are really one of the most important. Because it's the principle that is based to all the work produced in research. also the non-harmful approach. I mean, the principle I don't have the specific word in mind at this moment, but the principle is we cannot harm people. Our research, our purpose never need to have in mind that every step we give along the process, we are not putting no one in danger or in pain or so those are the professional skills that really we need to always keep in mind in anything we do in the care sector. The personal skills, well, IT skills, which I have problems today. I mean, with all that gear that I'm trying to use and didn't work very well, and I believe that referencing is one of the personal skills, the most important. To get the good references, know how to look for the things. Methods are, I mean, critical in my point of view, because everything depends on the methods that we are using. I guess that's why, for instance, myself, I still feel a little bit lost within with all this information, because I'm trying to learn the best methods to more simply arrive there. Criticism is having a critic vision towards everything we are looking at. It's very important. Commitment, yeah, commitment is hugely important. Time management, whoa. Time management, I guess, is what we all are trying to deal with, because we have the full agendas and, well, honesty, objectivity, yeah. Well, I could carry on talking a lot about this subject, which is hugely interesting, but I guess that I better stop right now, because I could stay talking all day long about this.
I know.
Anyway.